Diabetes is a common condition in the United States. Estimates are that more than 29 million Americans have diagnosed or undiagnosed diabetes. Dr. Patrick Bowen says one of the most common complications is nerve damage, or neuropathy.
Diabetic peripheral neuropathy is a term that refers to irritation or damage to the nerves that control sensation in the body. And diabetic neuropathy tends to generally affect the nerves that are farthest away from the brain and the spinal cord. So people can experience either burning pain in the toes or the feet. They can describe numbness or tingling, a pins and needles sensation in the feet, or in some cases just loss of sensation in the feet. Sometimes this can actually be a warning sign that you may have unrecognized or undiagnosed diabetes. If they're experiencing symptoms of diabetic neuropathy, it's important for them to let their doctor know about that, because the presence of neuropathy can not only be unpleasant for the patient, but it can also put them at risk for things like foot ulceration or foot infection.
Diabetic neuropathy is a difficult condition to treat. There aren't many effective medications to improve or restore nerve function. To avoid complications, the best thing you can do is control your blood sugar levels. Dr. Bowen also says home care is very important in maintaining healthy feet.
We tell patients with diabetes, and especially those who have neuropathy, that they need to be inspecting and looking at their feet on a daily basis. They can generally do this in the morning when they're getting dressed, or in the evening when they're getting ready for bed. We tell them to use a mirror to try to look at the bottom of their feet, and if they have difficulty doing this, they can have a family member assist with it. They should feel the surface of the feet, looking for lumps and bumps, areas of skin breakdown or blisters, hot or cold areas, and should also try to feel their pulse in the top part of the foot or behind the inner portion of their ankle. We tell them to wash their feet with generally warm water and to dry them carefully afterwards. If they have dry skin, they should be applying moisturizer, particularly to the top and the bottom of the feet, but avoiding putting that in between the toes. It's important for people with neuropathy to be wearing well-fitting socks and shoes and to be careful when going barefoot. Particularly if you've lost the ability to sense in the feet, then you may have areas that are rubbing against shoes, or you may have stepped on something that's irritating the foot. If you see areas of skin breakdown or early ulcers or infections, it's important to let your doctor know and get on top of that quickly.
Dr. Bowen says the worst thing you can do when experiencing diabetic foot pain is to ignore the symptoms.
The risks of not recognizing or not treating neuropathy is an increase in the risk of foot ulcers, foot infections, which can lead to more serious or life-threatening infections, or even amputation of the toes or the feet. Recognize that diabetes is common. If you're at risk, be screened. If you have diabetes, do the best job of controlling your blood sugars. And if you have diabetic neuropathy, pay particularly close attention to your overall foot health.
For CNN, I'm Adam McCoy.